Before turning it over to Dr. San, I'd like to give you a brief introduction. Dr. San completed her medical degree at McGill University and is a pediatric endocrinologist at the Scarborough and Rouge Hospital Centenary. She also has an additional practice in kinder pediatrics. Dr. San is also completing a Master's of Community Health with a focus on resident and patient education at the University of Toronto and also works for our DCAMS program. For more information on Dr. San, please read the speaker bio section to the left of your screen. So without further ado, I present to you Dr. San.
Thank you, Grace, and thank you for the invitation. I'm really excited to be able to speak to you about navigating independence. And really, today my hope is to provide practical tips on managing your child with type 1 diabetes. And really, I'm going to be focusing on the school-age child. So probably from grade 1 to about grade 6, so that kind of 8 to 12 age range. And really in situations where they're gaining further independence. So things like sleepovers, parents' night out, field trips. And I'm going to touch a little bit on school as well. But before we start, I just kind of want to get a sense of what the audience is like today. So please take some time and just let me know who you are. Are you a parent, a family member, a guardian, a teacher, a healthcare provider, or other? So I'll give you a chance to answer the poll question right now. All right, so let's see who our audience is today. So we have quite a few healthcare providers and some parents as well as grandparents or family members as well. So I invite you a warm welcome. I am tailoring this talk more towards the family, but I think some of what I'll say will also appeal to healthcare professionals as well. So let's start off with sleepovers. So I think sleepovers are a totally normal, wonderful part of childhood, and I think this should be no different for a child with type 1 diabetes. I always say to families when they say, my kid's been invited to a sleepover, what do I do? So these are kind of some of the strategies that I employ in my clinic when I see my families. So I would say maybe start with a trial run. Before accepting an invitation where your child is going to a sleepover, maybe do one with a family member or a close friend of yours, or maybe even host your own, so that way you're kind of in control of the food and insulin and diabetes care. I think if you have decided, you know what, they're going to go be invited to a sleepover at someone else's home, I think it's fine to contact the host early and be upfront about what type 1 diabetes means and involves. And I think give them the opportunity to understand what the management piece is. And it may not be reasonable to expect them to do all of it, but I think it's important to have that discussion of what they feel comfortable and what they don't feel comfortable with. And if the family's on board, I always say set up a time to demonstrate diabetes care, particularly monitoring a blood sugar and giving insulin either by a pen or by a bolus on a pump. And I think it's much better if this takes place before the day of the party. I always say maybe invite them over to dinner so that at your own home so they can see how things work. You can provide handouts. I think most of our learners these days are very tech savvy, and you might just want to take a video of how you check a blood sugar of your child or how you give insulin, and then just send them as an email link, or so that way they know exactly how you do it and they can watch it over and over again. I also say if you're going to give them a handout, these are probably the major topics you want to cover. So what are the 10 things you need to know about your kid with type 1 diabetes? How do you check a blood sugar? How do you treat or avoid low blood sugars? Or how to deliver a bolus on a pump, or how to give insulin? I get a lot of questions about food as well. I think that my approach with type 1 diabetes and food has always been, you know, I don't want the food to fit the diabetes should fit the food. And children should be able to eat whatever they want as long as they're giving insulin for it. So I think we can explain that to our children and say, you can eat whatever you like as long as we get some insulin on board for it. It might be helpful to kind of know what the menu is like beforehand, so you can maybe help your child and set out the carb counts for them and provide them doses ahead of time if they're on an insulin to carbohydrate ratio. I think the other thing is try your best. I think the goal is for them to have fun, and sometimes they might have a high blood sugar despite all the hard work you've done in trying to prepare ahead of time. And that's okay. For one day, it's not the end of the world. And you might want to help your child and the host family by having preset syringes so that they don't miss out on the fun trying to measure the insulin out and everything's ready to go. So they just have to put in a needle and inject it to make it a little bit easier for them. I think just as you're preparing your host family, maybe, we need to think about our kids as well. So maybe having a trial run the weekend before, have like a mock slumber party at your home, having your child demonstrate how to check a blood sugar. And I think children should have an understanding of what food has carbohydrate and what doesn't. I think the nuances of carb counting is quite an advanced skill that we might not expect of our 8 to 12-year-olds. I think giving insulin is a good question, and I always say it kind of depends. You know your child very well, and you are the expert in your child, and some kids are very mature, and perhaps they can handle being taught that, and sometimes maybe they're not, and that's all okay. I think it's important not to expect a child who's never given insulin before to be doing that on a night like this, and maybe that's something that the host family can help or support, or maybe as a parent you just have to go in and give it. So packing. So I think make it look fun. We don't want the child to feel excluded anyways, and diabetes bags, let's be frank, can look kind of boring. Online, you can find many fun bags that they can carry their diabetes supplies in, and that way they don't look so medical. I've also included for your reference a packing list that is a suggestion as well. So I think there's the essentials of blood sugar meter, extra batteries for your meter, treatment of low, so either that's juice or Dex tabs, whatever you choose at home. I think insulin, tips, pens, lancets, and a sharps container as well. I think in the event of pump failure, maybe giving a pen. That may not be something you necessarily want to do, but you might want to have ready at home. Definitely don't forget your PDM if you're using an Omnipod pump, and your charger if you're using a continuous glucose sensor. So the emergency kit is really glucagon and ketones. That might be something you just have on handy for yourself, or you might just want to keep with the child so that in the event of an emergency that you need to go up and pick your child up, it's already there for you and you don't have to worry about, where was the glucagon kit in my house? I think the other thing as a parent to try and be available. I think set up times for maybe check-ins by text or by phone and reassure your host or your child that, if anything comes up, we can always come get you. And if it doesn't work out, that's okay. And anticipate those problems. I think expect problems and plan accordingly. Making sure your family is aware of what a low blood sugar looks like. And if the blood sugars aren't looking right at bedtime, you may want to pick up your child rather than ask the host family to troubleshoot something like this. And remember, you can always bring your child back at the morning for breakfast time so that he or she can still participate in the fun. And I think that kind of sets out a conversation about being realistic. So if the host feels that, this is a lot of work for them and they don't feel comfortable, I think offer to come in yourself and give the needles and do the care. And I think it's best to give your child an honest response about, sometimes things happen. Rejection's always painful, but it's part of life. And if the host family for some reason feels like, this is too much and it's not working out, that's okay too. And I think you can have alternatives prepared, like have a plan B of, okay, well, we're not going to slumber party, but we're going to do our own slumber party and have our own movie night or something special. And, maybe right now is not the best time, but, just because it's no now doesn't mean it's no forever. And we can try again at another time. Or maybe even think about hosting your own. And I think that's the main goal that I'll share with you is just let your kid have fun. So let's move along to busy parents who would like a night out, and they're totally deserving of a break once in a while. So I get a lot of questions about how do you pick a babysitter, and how do I help organize a night out? So I think when we all look for a sitter, and I'm a parent as well, you want someone responsible, someone accountable, and someone reliable. I have some strategies that I share with my families as well about where do you find a sitter. I think family members who have been involved in diabetes care of your child is a great option. I think maybe even take turns with another family who has a child with type 1 diabetes. And I think there are great opportunities to meet other families with children of the same age, either through the Diabetes Canada family camps or through Diabetes Canada support groups, of which there are many. Another place to look for is teenage siblings of children who have type 1 diabetes, because they've probably seen or assisted their sibling check a blood sugar or maybe even give insulin. There, I'm sure, are local type 1 diabetes Facebook pages or social media pages that will give you an opportunity to find someone. Another good place is nursing students or nurses looking for part-time work, because they will have that medical background as well. There is another interesting website that I came across in preparing this talk called safesittings.com. It's an American and a Canadian site, and they're actually specifically babysitters for families with diabetes, which I thought was fascinating. They have a search engine where you basically type in your postal code, and they see within a 10, 20-mile radius who's available to you. So how do we prepare our sitter? So I think give the sitter time to practice your child's diabetes care and to get to know each other and kind of time to learn those new skills. I think, again, leave written handouts or videos, whatever I think is the best learning device for you and your family. And I think it's pretty similar to kind of what you'd say for your host family at a sleepover. So I think the big things, again, are emergencies. Where do you find the diabetes supplies and snacks? How to check a low blood sugar, how often, when, what's the target, and also demonstrating to them how to give insulin shots or how to deliver a bolus on a pump. And I think the big checklist is that pretty much. And I would say making sure they're very comfortable with the signs and symptoms of low and high blood sugar. So what about the food? Again, a big question I get. So provide foods that you know your child would like, and I think involve your child in the planning of these meals so it feels a little special for them too. I think give your babysitter a schedule and a menu, and give them options. So like let's say your child doesn't want option 1, they have option 2 or 3 to fall back on, and then indicate how much insulin your child would need to cover for those foods. So you might even want to do it visually of like, muffin, this amount of grams, and rather than having them do it through an insulin to carbohydrate ratio, if that's what you're using, just say this much insulin. It might just make it easier for them. And I think if your child refuses to eat what they want, review the substitute foods or have them call you with questions. The American Diabetes Association has this great kind of one-pager about a safe diabetes sitter guide. And I've provided the PDF link on the bottom of the screen for you as well, which we can share with the audience as well. And it's a one-pager of the basic things that they need to know. So the contact information, what are high blood sugar readings? What are those symptoms like? What are low blood sugar readings? What do the symptoms look like? And what I like is at the bottom, they have these high alert situations and reminders and times when, you might want to be notified as a family. All right, so moving right along to field trips and school. So I think this is a really big topic, and I'm going to give you kind of a basic overview and some resources that you can look towards. So I think where to start. I always say ask your diabetes team. Most of the pediatric diabetes centers already probably have resources for school and for field trips, and I think it's always great to troubleshoot your concerns with your team's input, perhaps at your clinic visit, or maybe even calling up your diabetes nurse educator to say, hey, this is happening. How do you think I should best prepare this? I think another thing is know your rights. The Canadian Charter of Rights and Freedoms does say that anybody with any medical condition or a disability is entitled to the same rights as that of any child, and that there should be no discrimination whatsoever. there is, I'm going to be giving you some information from a position statement that was a joint effort through the Canadian Pediatric Society. So these are general pediatricians, through collaboration with the Canadian Pediatric Endocrinology group as well, and through Diabetes Canada. So this was a kind of recommendations for, what are our collective thoughts as healthcare providers and diabetes advocates of what should be happening at school. So what should we expect from our schools? I think, one, an understanding of what diabetes is and how type 1 diabetes is not type 2 diabetes, and two, people with type 1 diabetes are not the same, and every child should be looked at from a unique perspective. I think they are deserving of a clean, convenient, and safe place for their safe care, and respecting the student's right for privacy if they want so, or if they feel comfortable doing it in public, that's fine too. I think diabetes care tasks should be integrated into the child's regular daily routine, ideally with little disruption. During meal times, it is helpful to have a designated staff member who understands the nuances of diabetes care to supervise meals and snacks, and making sure there's adequate time to consume a meal. I know that some schools have kind of like health break 1 and health break 2, which can be challenging, and some schools are moving towards having like an official lunch, like I did back in the day when I was at school. So I think these are things to navigate and highlight to the school that, this is how much it takes to check a blood sugar and give insulin, and make sure that's built in. And I also think that, some school-age kids who are maybe in the older grades are giving themselves insulin at school by themselves, making sure someone's there to support them. For the younger kids, most diabetes clinics will try to get CCAC or a family member to come in and help. But I think that the school age group, they do not have the capacity in their brain to do this on themselves. And I think it's important that they feel somebody is there to help if anything comes up. All right. I think the big thing from the schools is they need to know what a low blood sugar is, what it looks like, and how do you treat it. In the event of a severe hypoglycemic event, so I define a severe hypoglycemic event a seizure or loss of consciousness, so something pretty serious. I think that should be a 911 call first, and then a call to mom and dad or guardians. I get a lot of questions about intramuscular glucagon, and I think this is an area of great debate, and I don't think there's consensus amongst our community of healthcare professionals and advocates. I think what I feel comfortable saying, according to the guideline, is I think intramuscular glucagon may not be feasible for every school. I think that if you're in a rural part of Ontario where the time for EMS is greater than 20 minutes, that's pretty long. And maybe we need to advocate for those schools and provide support so that school personnel can be trained to administer glucagon. There was a great study that came out that looked at, even families and healthcare providers who are trained to give glucagon. There were so many errors that occurred, either of mixing. Sometimes they, in the heat of the moment when it is a stressful event to, I think, see a seizure or someone who's lost consciousness due to hypoglycemia, and mistakes happen, even in healthcare providers. So the study did show that the errors that occurred was either they forgot to take the liquid component, so the saline component, and mix it with the powder. So they're actually just giving saline instead of the actual glucagon dose. I think also the reconstitution, like you have to put the saline and mix it a little bit. The mixing was not necessarily adequate. Sometimes the injection was given wrongly. So even as healthcare providers, during these times, we are fallible as well. So I think giving glucagon is a complex act, and I think to ask for our schools to be trained in that may not necessarily be feasible. So the other thing is I see many kids have lows in school, and I feel strongly that there should be an accommodation for tests and quizzes during that time. It takes about our brain 30 to 60 minutes to recover from a hypoglycemic event and regain our cognitive capacity. So, of course, if this is occurring before a test or during a test, I think the allowance should be given for extra time. children should be allowed to keep their meter and a snack as well as a juice box at their desk. This shouldn't be in the locker or in the principal's office. This should be somewhere nearby. No child with hypoglycemia should be walking across the school to be getting their supplies. This should be in the room with them. So I think one thing that I see as a healthcare provider is I get a lot of conversation about high blood sugars at school. And I think that, treating highs is really about looking at patterns and looking at the numbers. And I think that's a job really for the child's family and guardians involved, and with input from the diabetes team. So I think a lot of schools get nervous when they see a blood sugar of 15. And we all know that we never react to an isolated single high blood sugar. The important thing is to look at the trend over a week or over 3 days to see what's going on. And I think that school staff shouldn't be fiddling around with the insulin doses without any parental involvement. I always say to parents and guardians that you are your child's expert for diabetes. You are with them every day. You know your child well. And I empower you to make those decisions with the school. I want to highlight some really great resources that Diabetes Canada, the Canadian Pediatric Society, and the Canadian Pediatric Endocrine Group have put together, and I think this is really a labor of love, and it's a really wonderful website. This is the website itself. It's diabetesAtSchool.ca. There's a section for schools, and there's a section for parents. And what I love about this website is if you click on the school section, and that's what you're looking at right now, there is a list of topics of an overview, a low blood sugar, high blood sugar, kind of going through the whole step-by-step, and they have a video series with key concepts as well, which I think is helpful. That visual way to learn, I think, is really helpful. And for parents, similarly, we have a parent version of all those documents with a video series as well. So I think both of you kind of know what is being said, and it's a transparent conversation. So how can you support, you as a family can support school staff? So I think discuss this before the start of the school year and develop what we call an individualized care plan. And what the individualized care plan should include is really what are the roles and responsibilities of everyone? What is mom, dad, family members' responsibility? What is the principal's responsibility? What are the teacher's responsibility? And if you're ever not sure what this includes, you can always have input from your diabetes team. And I think every team does this differently. The institution that I work at, we usually start by troubleshooting things over the phone, but our social worker and our diabetes nurse educator have been known to go into the school and speak to the entire school staff for this child as well. And really, this should be a clear document, and that gets updated maybe every year, or if you're changing from an insulin regimen to another, these are things that should be updated. So just to summarize, the school-age children are really in a period of transition towards independence. I think it's very normal to be apprehensive about sharing the responsibility of diabetes care with your child and other caregivers. But I really do think with preparation and planning, you and your child can really enjoy these years and enjoy sleepovers, having a night out, getting a break, and going to school and enjoying field trips as well.